Thank you for seeing the video. I am Shinichiro Maeno, a certified instructor of the Japan Pain Rehabilitation Association. We teach the latest fascial release, applying fascia connection in Japan nationwide. I think that I will think about back pain and the treatment of the spinal column erector muscle in this movie. In back pain, it's important to find out where the cause is based on the evaluation. Clinically, many people are desk work and low back pain, as shown in this figure. The pelvis is inclined forward, the hip joint is bent, and the back pain is more in the posture in which the lordosis of the lumbar spine occurs. So how does posture that's in position of hip joint, pelvis and lumbar bulb to affect low back pain? It causes a condition called lower crossover syndrome, hip flexion as shown in the previous figure, pelvic anteversion, lumbar anterior kyphosis leads to the development of pain from lower crossover syndrome. The muscle on this purple hatched line is short and hard. The reason why it's short and stiff is that if the hip flexion and the lumbar anterior kyphotic attitude, the intestinal psoas muscle, which is the muscle of the lumbar vertebrae, becomes short, and the lumbar vertebrae is lengthened. The spinal column stretcher also becomes shortened and becomes tense as well. If such a condition persists, it naturally leads to the occurrence of fascial pain derived from muscle tension. And the green line is a weak and long muscle when hip flexion, pelvic anteversion, lumbar lordosis, major gluteus, and abdominal muscle are pulled. If this happens, you will not be able to fix the trunk with the abdominal pressure of the abdominal muscles, so the back muscles will fix the trunk and will become back pain from the tension of the spine. In this way, it usually leads to low back pain from posture during work, and in many cases, it leads to lower back pain from tension of the spinal column erector. Therefore, there is a need to evaluate the spinal column erector for low back pain and release the fascia if it's the cause of pain to improve back pain. As a supplement, research on this kind of spinal column striker is known. Activity is high in cases of chronic low back pain, increases pressure on the spinal column. Manipulation is not effective in situations where spinal column elevation activity is high. Healy 2005-2008. How was the video? I will summarize what you want me to go now to you who saw this video. Number 1. Examine the function and the structure of the spinal column erector in the textbook. Number 2. Please evaluate the spinal column erector after understanding the function and the structure. Number 3. If you evaluate and the spinal column erector is involved in the cause of the pain. How was the video? I will summarize what you want me to go now to you who saw this video. Number 1. Examine the function and the structure of the spinal column erector in the textbook. Number 2. Please evaluate the spinal column erector after understanding the function and the structure. Number 3. If you evaluate and the spinal column erector is involved in the cause of the pain. Please release the fascia. Thank you very much for seeing the video. So far though I told you last, we teach manual therapy centered on fascial release in Japan. If you are interested, please have a detailed link of our association in the description section of the video. See you next time. Thank you.